Well, imagine not being able to grip a pencil, put on socks, even hold a cup. That is the reality for people with spinal cord injuries.
But CBS 2's Dr. Max Gomez shows us researchers are now using a device to actually reroute brain signals and help restore movement. Doctor.
Yeah, that's right, Maurice. There are about 12,000 spinal cord injuries every year in this country, mostly in young men, leaving them partially or completely paralyzed. The problem is that a damaged spinal cord cuts the signal between the brain and the muscles of movement. This device bypasses that roadblock. Brian Gomez, no relation, is building a coffee roasting business and hopes one day soon he can actually hold and drink a cup of his own coffee. In 2011, Brian broke his neck in a dirt bike accident, leaving him in a wheelchair with limited use of his hands.
The hardest things to learn, just putting on your socks, learning how to eat, like the things that you wouldn't think would be hard at all.
Normally, regaining any hand movement this long after an accident is rare. But today, things are getting better for Brian, thanks to an innovative surgery.
Spinal cord is a very plastic and very smart organ that can be, the circuitry can be rewired.
Which is what Dr. Daniel Liu is hoping to do. Through an NIH-funded study at Ronald Reagan UCLA Medical Center, he performed the first surgery in the world that uses a 32-electrode stimulator. It detours around spinal cord injuries and finds new pathways to deliver brain signals directly to a patient's hands. 2 months after the experimental procedure, Brian was once again able to use all 10 fingers.
Left arm at 2.
Today, he continues to undergo rigorous physical therapy, where researchers fine-tune the signals from the stimulator and chart Brian's progress. In the 3 patients who have received the device at UCLA, hand function has increased by as much as 300%.
Meaning that they can now use your hands for daily tasks, like typing on a computer or using a phone. You know, in Brian's case, you know, grinding coffee beans.
Things are about to change for better, so you get more excited. At least I did, got more excited about what's to come.
Now, other devices and approaches are being developed, including ways to use brain waves to control robotic limbs. But this is implanted in the spinal cord, not the brain, and helps the patient move their own hands. Eventually, doctors hope to be able to heal the spinal cord itself and regenerate brain fibers across the injury, but that's still a little ways off. But it's actually being worked on very actively right now.
Sounds closer than ever.
It really is. We're
Progress.
getting there. We're getting there. It's progress.
You bet.
It's a little bit steady. You bet.
Thanks, Dr.